Next up, we have a 2-for-1 special. We have Darby Swain. She graduated from Samuel Merritt University in 2020 with her doctorate in physical therapy and is working at the Sports Medicine Center for Young Athletes here in Walnut Creek and then also in San Ramon. She recently received her orthopedic clinical specialist and is also part of the sports medicine concussion team. She enjoys treating all types of patients, but has a particular interest in patients that have suffered concussions and soccer-specific patients. We also have Alyssa Bolt. She's an athletic trainer at UCSF PlaySafe program and is the head athletic trainer at Balboa High School and San Francisco International High School. Alyssa earned her bachelor's at San Diego State University and completed her master's at the University of Michigan. She enjoys teaching and practicing yoga, is committed to enhancing the well-being of youth populations through movement medicine. Welcome, Darby and Alyssa.
Hi everybody, my name is Darby Swain and I'm going to be talking to you guys today about strength and conditioning for the female athlete. I do not have any financial disclosures related to this presentation, and here are my objectives that I'm hoping you guys get by the end of this talk. So when we think about the female athlete, we know that over the past 40 years, the number of girls and women participating in sports across all levels has boomed, and a lot of this was due to the enactment of Title IX in 1972. 71-72, there were over 3.6 million boys participating in high school varsity sports compared to only about 300,000 girls. But after the enactment of Title IX by 2018-2019, the number of girls participating had risen to 3.4 million. We saw similar trends occurring at the collegiate level too, with a sharp increase in female athlete participation. And in 2024, the Paris Olympics was the first to reach a 50-50 split, making it the first gender equal Olympics in history. So female athletes are on the rise in terms of their participation, so we need to understand how we can strength train these individuals to optimize their rehab results. So when we think about the physiological differences between a male and a female athlete, we know that female athletes in general have a higher relative strength increase, specifically in upper body muscle groups, and specifically in the earlier phases of strength and conditioning training, versus males have an absolute strength increase that's higher than their female counterparts. Females will have a higher prevalence of slow twitch type 1 muscle fibers, which will allow them to have this potential for increased endurance capacity, while males have a higher prevalence of fast twitch type 2. Hormonally, and this is where we're going to spend a lot of time talking about today, we know that males have increased testosterone, which they theorize can lead to that more type 2 muscle fiber development with increased potential for strength and power, versus females have estrogen and progesterone that can cycle and increase and decrease around a menstrual cycle, which we'll dive into next. And then finally, female athletes have increased lipid utilization during exercise versus males have more carbohydrate utilization. So looking at estrogen and progesterone and their roles in strength and conditioning, we know that estrogen promotes carbohydrate breakdown through glucose uptake and hepatoglycogenolysis, while promoting fat use and sparing our glycogen stores. So overall, it has this neuroexcitatory effect that can lead to improved strength and power outcomes. Progesterone kind of has more of the opposite effect. So it is a muscle relaxant that can negatively affect muscle contractile forces. Higher levels can promote protein breakdown and reduces muscle strength and protein synthesis, and it has a neuroinhibitory effect that results in negative relationships with strength and power outcomes. And then within the menstrual cycle, we know that these hormones fluctuate. So this leads to the discussion of, is there potential for greater strength and power outcomes in different phases of a female's menstrual cycle? So when we look at the early and late follicular phases, we know that this is where progesterone remains relatively low and our estrogen levels peak. So this has the potential for greater strength and power outcomes in this phase. As we transition into the ovulatory phase, we have an increase in testosterone production, which could lead to improved neural activation, muscle contractile properties, and motor system functions. And then as we get into the late luteal phase, we know that it kind of flips, and we have estrogen that is lower, progesterone is higher, and the potential for lower strength outcomes overall. So this is, in theory, what is happening during the cycle. So I wanted to look, well, what does the research say? And there was a narrative review that came out, I think in 2022, that really looked at the impact of the menstrual cycle on both objectively measured performances with aerobic, muscular, and anaerobic training, as well as perceived performance, which we'll talk about next. So in both the aerobic and the anaerobic realms, it was kind of a mixed bag, trending more towards the direction of that there isn't much of an impact. So 14 of the studies that focused on the aerobic component showed that the menstrual cycle phase had no effect on continuous endurance performance, with a few having potentially greater ability to perform an intermittent endurance tests in the follicular phase. Anaerobic, we saw a similar trend as well, with most of them citing that there was no effect. One had some, but again, it was more related to perceived performance. But the area that we can have the potential for the greatest impact on developing our strength and conditioning programs is going to be in the muscular strength realm. So this was the area that was most likely to be impacted by a menstrual cycle phase, again, via those estrogen and progesterone concentrations. So they recommend that strength training can have its best results in both the early and late follicular phase when estrogen is peaking. Again, it was a mixed bag with a few studies showing that there was no difference in phase, but muscular strength is the area where there's the most amount of positive research for this concept. And then they finished talking about impact of menstrual cycle on perceived performance. So how an athlete is feeling when they're in a different part of their cycle based on their fatigue level, pain level, discomfort can impact how they're going to perform with your strength and conditioning program or on strength and conditioning tests. So 50 to 71% of women reported feeling that their performance in training competition was impaired in certain menstrual cycle phases. And it was best in all phases except, again, for that early follicular and late luteal phases. So perceived performance can be just as important, if not more, than some of these objective measures. So what is the overall impact? It was mixed. 20 of the 35 relevant studies concluded that the menstrual cycle did not produce significant improvements and impairments, but like I previously mentioned, the area that did have the most positive results was in the strength phase, or the strength aspect of strength and conditioning. In studies that did show an effect, performance outcomes were relatively reduced in the late luteal phase more than any other phase, and there's a better opportunity for strength gains in the earlier half of the cycle. Perceived performance can be just as powerful and influential than objective measures and should be considered when structuring training. But as I was going about putting together this talk, the most overwhelming thing that I found was that we have very little research out there on the female body and how these factors can impact our ability to properly strength train and rehab our athletes. So we need more research in this area if we're going to properly work with these individuals. So now that we understand that there is some potential for biasing certain aspects of our strength and conditioning programs around the cycle, I did want to take a minute and just look at, well, when we do strength train our athletes, how does a woman's body respond versus a male's body? And I found this great systematic review that looked at sex differences in resistance training. It compiled about 50 studies altogether that really showed that there is no difference. When we ultimately go out there and we appropriately load our female athletes, they respond in a similar way than our male athletes do. So there was no significant difference in muscle hypertrophy between males and females. And in fact, there was a significant effect favoring females with regards to increases in upper body strength versus male counterparts. Lower body, it was about the same, but in summary, resistance training has similar, if not greater, effects in certain areas in women versus men respectively, and both males and females can considerably increase muscle strength and size with proper resistance training. And again, this was the first meta-analysis completed on sex differences and their response to resistance training, and this was published 2 or 3 years ago, so we need more research. Finally, I wanted to touch a little bit on common injuries affecting the female athlete and particular strength and conditioning programs that we can utilize with these athletes for injury prevention. So as a lot of us know, ACL ruptures disproportionately affect our women athletes more than our males. We also have other things like patellofemoral injury, ankle sprains, shoulder instability, and overuse that can also be impacted more greatly in a female than a male, but we're going to focus a little bit more on ACL ruptures. There are a variety of different reasons as to why this happens. We could probably do a whole discussion on this, but just briefly, hormonally, there is an impact, or the hormones of a female can impact the strength and elasticity of the ligaments. Anatomically, there's the pelvis and Q angle differences, muscle strength. We have a greater quad to hamstring ratio and balance. And biomechanics, there's an increased likelihood for females to land in a valgus position. So what is our role in all of this as physical therapists and strength and conditioning specialists? We need to understand how we can go out and impact these athletes in terms of injury prevention. So in 2023, there was a clinical practice guideline titled Exercise-Based Knee and Anterior Cruciate Ligament Injury Prevention, with the overwhelming sentiment being that there is A-level evidence, which is the highest level in a clinical practice guideline, that we should be providing exercise-based knee injury prevention programs for athletes at higher risk for ACL injuries, which are our female athletes. What did this clinical practice guideline outline? When we are developing these programs, we want to make sure that they have a combination of strength, plyometric, and proximal control. And all of the programs that we'll go over next have some combination of all of those things. We need to be doing these programs multiple times per week in sessions lasting longer than about 20 minutes. We want to start preseason and continue throughout the regular season, and we want to ensure high compliance, particularly in our female athletes, specifically in ages 12 to 25 years old in high-risk sports, which they defined as soccer, lacrosse, basketball, volleyball. So really important that we're ensuring compliance in our high-risk athletes. The first program that they talked about, which I think a lot of us have probably heard of before, is the FIFA 11+. It's one of the most highly researched ACL injury programs out there. With the first kind of phase being just a general running warm-up, and then progressing into phase 2, which is kind of the bread and butter of the FIFA 11+. This is the strength, plyometrics, and balance phase. And the great kind of part of this specific program is it divides it into 3 different levels. So there's level 1, level 2, level 3. So it's really customizable to the athlete that you have in front of you. If you have somebody that's younger, that doesn't move quite as well, we don't have as much time for, dedicated supervision. We might be starting more in the level 1 aspect. But if we're working with a higher level athlete, high school, college, we can progress into level 2 and level 3. In the strength and conditioning, or the strength component, of all of these programs, they target major muscle groups, including the core, quads, hamstrings, and calf. And then they progress eventually into both double leg and single leg plyometric exercises. And then the FIFA 11+ wraps with some more running exercises, but focused more kind of on agility. So planting and cutting, running and bounding, running across the pitch. And like I previously mentioned, there are multiple studies out there that really show that there is a significant reduction in injuries in female athletes if this program is appropriately applied. The clinical practice guideline also outlined the PEP program, a little bit less detailed than the FIFA 11+ and the sports metric that we'll go into next, but similar components where we have some sort of dynamic warm-up, moving into strength, plyometrics, and agility. This is the only program that really talks about more static stretching after they finish their training session, so targeting all of the major muscle groups in the legs, the calf, quad, hip flexor, hamstring, and adductor. And then finally, they touch on the sports metric program. We use a lot of sports metric components in both our ACL rehab and prehab at our clinic here. And just like the FIFA 11+, they divide it into 3 different intensities. So low intensity, medium intensity, and high intensity days. So it's really customizable for the athlete in front of you, starting with some sort of dynamic warm-up. And then they move more into their plyometric phase next, so double leg and single leg impact activities. I think the sports metric program increases the challenge with plyometric activities a lot quicker than some of the other programs do. So if you have a higher level athlete, this might be a more appropriate program for them. And then component 3, again, is the strength phase. So working on all the major muscles in the leg and the core in both double leg and single leg exercises. And then wrapping up with agility. The sports metric program recommends that we use components 1 through 4, so all of the components when we're in this preseason phase. But as we transition to in-season, we remove a lot of the heavier strength stuff and just focus more on plyometrics, agility, and good warm-ups. They recommend that we perform low-intensity days on game days. And again, we can progress and regress intensity levels depending on the age, skill, and movement quality of the athlete. So in summary, the number of women participating in sports is on the rise. Studies show that there may be some impact from a female's menstrual cycle on strength and conditioning principles, and we should be considering this when developing our programs. ACL injuries are one of the most common injuries we see in the female athlete, but there are a variety of high quality, highly researched strength and conditioning injury prevention programs that we should be utilizing. And like I've said a few times, we need more research on the female body to effectively treat our female athletes. Here are my resources. I unfortunately will not be available for questions today, but if you would like to reach out, please go ahead and send me an email. That will be provided at the end of the conference. Thank you.
Thank you. Hi, everybody. Thanks, Darby, for talking about all those physiological differences between male and female. So now I can just talk about yoga with you all. I'm a yoga instructor, if any of you didn't know. And specifically what I wanted to talk about today is how it can affect our athletic populations, but then do a little bit of talking about how it can gear it towards female athletes as well. I have no disclosures or disclaimers, except for maybe I'm a little biased because I am a yoga teacher. Okay, raise your hand if you've ever done yoga before. Beautiful. Raise your hand if you've ever advised one of your patients or athletes to do yoga. Okay, wow. So I'm preaching to the crowd here, aren't I? I'll just give a little bit of background first. So yoga was originally founded in 1500 BCE in India. The oldest teachings were in the Vedic scriptures, or the Vedas, and it was a group of mental, physical, spiritual practices and disciplines to help calm, control, and still the mind. And then it was brought to the West in the 1890s by a group of different gurus. There's actually 9 different branches of yoga. Asana is the physical practice that we know today that we've brought to the West that we mainly talk about. That's like the postural and the movement. But things like pranayama, which is breath work, meditation, and there's all sorts of other different mental practices. So yeah. Okay, continuing on. So today in the United States, we focus on the main things, the asanas, pranayama, dhyana, which is meditation. And not only is it helpful in a physical way, but also a mental way. Raise your hand if you've given yoga to a patient for mental well-being. Yeah. So it's more than just the physical practice. It could help with a lot of different things. There's a bunch of different types of yoga. Vinyasa is probably like the more common that you've seen in the West. It's a flow style of yoga where the poses are synchronized with the breath in a continuous rhythmic flow. As you can see this little chart right here, this is Surya Namaskar A, which is Sun Salutation A, going through all the different postures that you will repeat multiple times in the Vinyasa practice. You'll also see this in Iyengar, Ashtanga, and Bikram yoga. Other styles of yoga that you'll see are Hatha, which is like a slower, more gentler form of yoga. You're holding postures for longer, but you'll also kind of see this like repetitive movement. This is less so the one breath, one movement, more so like a slower way of going about it, more so like balancing, opposing. You'll see like more isometric holds through this practice. Yin yoga is what we would call more so a static stretching class. You're holding poses for at least 60 seconds long. So this may not be appropriate for some populations, but if you're trying to get some real muscle lengthening, you'll see that as well. And there's also aerial yoga, restorative, and then acro yoga too. Okay, so these are some of the general studies that I've seen in like the athletic population talking about how it can affect delayed onset muscle soreness, which we'll see a lot of our athletes deal with, as well as addressing flexibility and balance. One of the studies that I looked at was 10 weeks of yoga practice. This was actually only males, college-age athletes. They did 10 weeks of yoga bi-weekly. And it actually showed some gains in flexibility and balance. We also looked at perceived, so Darby talked about this too in her talk as well, but perceived performance. There was a study about distance runners and doing yoga prior to an event and how they perceived their performance and readiness prior to, and that helped some of that population as well. And then also some studies talking about depression and how it can affect. I only have 15 minutes, so I'm kind of gonna, instead of talking about all the little data points, I'll kind of just talk about the summary of some of these studies, specifically on athletes, not just females. It can help manage stress and anxiety. That 10-week study that I talked about helped with flexibility and range of motion. It can also help with balance and proprioception, help relieve pain in areas that you're finding tightness, as well as regulate sleep, improve muscular strength if you're doing something like a vinyasa or a hatha where you're doing isometric and repetitive motions, and then can also help with blood pressure and diabetes and obesity. One thing that I wanted to really focus on was athletic recovery. When an athlete comes to you and they're experiencing, delayed onset muscle soreness, a lot of like the fad things that you hear about them doing are like ice baths and like using like the Normatec like leg boots and things like that. But really what the literature shows is the best thing that they can do is active recovery and actually sleep and eat. And so yoga can be like a mechanism of getting that active recovery. I also say like biking, walking, that's good too. But this is a great way for them to do a lower impact, slower activity that's actually going to help with their DOM symptoms and also help with their mental readiness as well before they go on to their next athletic event. So like I said earlier, it can help with muscle tightness, brings blood flow and encourage lymphatic movement since they're actually actively contracting and relaxing their muscles, improve cardiovascular performance, and enhance their state of relaxation. Okay, this one is now geared a little bit more towards females in the athletic population. So one of the main things that Darby talked about was menstrual cycle and how the hormones fluctuate throughout their whole cycle. And specifically for women, a couple of the studies that I looked at talk about menstrual pain and how yoga was actually beneficial for menstrual pain. One of the studies that I looked at was a randomized crossover pilot trial on daily mindfulness yoga practice on menstrual cycle symptoms and measuring their well-being. Another one was yoga on menstrual pain, physical fitness, and quality of life in young women with primary dysmenorrhea. So the first one, it showed that it was statistically significant that yoga helped decrease bloating, low back pain, menstrual cramps, and stress for women during their menstrual cycle. It was 20 women, and all they had to do was 10 minutes of yoga every day for 2 weeks, or during that period of time that they were experiencing their symptoms, and that was helpful for them. In the other study, it was women 18 to 22 years. It was 34 volunteers, and it was a 12-week study period. They did yoga for 30 minutes every single day, or not every single day, 30 minutes per day, twice a week. And it showed that they had a significant improvement in menstrual pain, physical fitness, and quality of life compared to the control group. So this may have been a study that showed that adding yoga into the lifestyle of women with primary dysmenorrhea could be helpful. The other two studies talk about depression and how mindfulness can affect people as well. Those studies also showed it was statistically significant that mindfulness practices reduced stress and anxiety and improved athletes' sport performance. Okay, so how this applies to women, like I said earlier, 70 to 90% of women experience menstrual discomfort. 62% of women say their menstrual symptom pain is severe, and 10.3% of women experience major depression in a given year. 35% of female athletes struggle with mental health struggles. So this is the patient population that we're taking care of, young female athletes. And this is a tool that we can give them to help with their symptoms. That's not just medication or just deal with it. Okay, so some of my takeaways. Yoga is beneficial not only in the physical, but mental well-being of female athletes prior to or post-competition. It can help reduce menstrual symptoms and increase perceived athletic performance in female athletes. It can easily be supplemented, like one of the studies showed, all you need is 10 minutes every single day and you can make a difference. And even doing a few poses or doing breathing techniques has shown to be beneficial. I do have time for questions if anybody has any. Yeah.
In those studies,
Yeah.
did they specify the type of yoga, the focus?
Yeah.
Was it Hatha, Ayana, what's it?
A majority of them were vinyasa.
Vinyasa?
Yeah, so the one breath, one movement flow.
Okay.
Yes.
Do you have like a link or recommendations for 10 minutes advice?
Wow. Honestly, if you go on YouTube and you just Google 10-minute yoga flow and look for something that's like the one breath, one movement, I think I'd recommend that. Yes.
Sorry.
No.
I often see patients get injured in yoga.
Sure.
Because they are trying to compete with their instructor, trying to do positions that their body cannot do.
Yeah.
So I always tell them it's an individual practice.
Exactly.
And don't forget that.
Yeah.
It's individual.
That's so true.
And so don't have anybody push you, you have to do what is comfortable for your body, but what do you say as an instructor that they should do?
Yeah, when I am teaching classes, like you are competing against no one except for yourself. Like this is your own practice. Whatever you need for that day, you should do. It's not, oh, I have to do this like really hard balancing posture because I did it last week.
Right.
It's like meet yourself wherever you are on the mat. You don't have to, there's certain expectations that you have going in, like leave those at the door and do what you can for that day and like what feels good for that day. Because you're not competing against anyone. It's all for yourself.
Are most yoga instructors saying that?
Yes, they should be. But I take a lot of classes
They're
too.
educated that way.
Yes, and a lot of them they will tell you that this is for yourself and don't look at anybody else around you.
Okay.
It's just for you. Yeah. Anything else? Yeah.
How focused are you on really good proper posture, like specifically the pediatric side?
Yeah.
So ignoring the adults or pediatric side.
Like
do you have them do yoga in your clinic before you say, hey, go find something online?
So usually so when I'm at the high schools, usually the way that I add yoga into my practice, I'll add it into like a rehab program. And so if they have like back injury and I need them to like mobilize their spine, I'll add in like cat-cows and stuff as part of their program. Or like if I know they're dealing with like performance anxiety, like before races or something, I'll like teach them a breathing technique. Usually I'm kind of doing like more so like little chunks in that population. Less so telling my pediatric population to go and do like yoga classes. Yeah. All right. Okay. Well, thanks everybody. That's it.